So why does this matter? Why is high insulin a problem? As I mentioned, one, high insulin blocks fat burning. So you're never going to tap into your body fat. You're never, even if you're not eating a ton of calories, you're going to not be able to tap into that fat that's stored on your body. And if you're trying to lose weight, this is a huge problem. High insulin also drives hunger and cravings. So you're going to constantly crave sweets. You're going to constantly crave those things that are really, really bad for you. Actually, chocolate is one of the biggest offenders. Why? Because not only is it sweet, but it has caffeine in it, and both of those things drive cravings. High insulin also encourages fat storage. So it's going to tell your body all of this energy that's coming in, you have to store it away for later use. And the worst thing is it's going to store it mostly around your belly and in visceral fat, which is the most damaging, most dangerous kind of fat you can store. So many people are gaining weight and getting more diabetic at the same time because the diet advice is still centered around the very thing that spikes insulin most, and that's carbohydrate. And there's a huge focus on calories. Calories are not the primary thing that we need to pay attention to when we're trying to lose weight. It is a factor, it plays a part, but the hormones involved are the messages that are guiding and telling the body what to do with those energy stores. If your insulin is very low, your body is going to tell the cells, or your hormone levels are going to tell the cells to burn and utilize that energy coming in for fuel. Yet, if your insulin levels are very high, that same messaging is going to tell the cells, hey, you need to store this away for later use. So let's talk about what conventional medicine does, what versus what functional medicine, which is what I'm studying and learning about right now, and the way that we approach things. So conventional medicine often waits until the blood glucose or the A1C gets bad enough or reaches that certain level of A1C that they now diagnose you with diabetes, and the first thing they're going to do is throw medication at you. And that's why I said metformin, insulin resistance, type 2 diabetes, and prediabetes is not a metformin deficiency. Metformin is typically the first line drug that they'll throw at you. So again, what they're focused on is blood sugar and lowering that blood sugar, which is important, but it's not getting to the root cause. Well, here's where functional medicine differs. Functional medicine is root cause thinking. And we ask ourselves things like, why is insulin high in the first place? And how do we lower the need for insulin? And those are the types of things we should be focusing on. Those are the types of things that your doctor should be focusing on. And the fastest lever for reducing blood sugar and insulin levels is reducing the carbohydrate load. So that's where we really need to focus our attention. We need to get those carbohydrates down. Particularly, we need to eliminate the ultra processed refined carbohydrates that are really responsible for the obesity and the prediabetes and diabetes and insulin resistance. So you can go any of three ways, and I think each of them has their benefits. So the first way is to do low carb, and low carb means that you're reducing the foods that spike blood sugar the most. The second thing you can do is a ketogenic diet. And ketogenic diet means that carbs are low enough that the body shifts toward using fat and ketones for fuel. Ketones are a breakdown product of fat, and ketones are incredible for weight loss. They're incredible to nourish the brain. We've found that heart disease responds very well to ketones for fuel, and it doesn't require insulin to be able to use that as energy. And then the third way you can do it is through a carnivore diet. And this, of course, if you know me, you know that I eat a carnivore lifestyle. This is the most aggressive version, removing nearly all of the carbs and acting like the ultimate elimination diet. Now, I want you to understand that it's not necessary for you to go carnivore. All three approaches will lower your insulin demand. So low carb, keto, or carnivore, carnivore is really just a subset of ketogenic diet. And ketogenic diet means, again, that you're using fat or ketones for fuel. So here's what the evidence actually shows. Even the ADA acknowledges that low carbohydrate and very low carbohydrate eating patterns can reduce A1C and can improve other cardiometabolic markers in people with type 2 diabetes. And the ADA, of course, is the American Diabetes Association. And there was a 2-year clinical trial of low carbohydrate intervention with nutritional ketosis, meaning a ketogenic diet. Participants had lower A1C levels, lower fasting glucose, lower fasting insulin, reduced body weight, reduced triglycerides, lower blood pressure and inflammation, while many reduced or eliminated diabetes medications. So diabetes reversal occurred in over 50%, 53.5% reversal of diabetes, and remission in 17.6% of participants. So reversal doesn't really mean that you're cured forever. What it does mean is that blood sugar control has improved, often with either fewer or no medications, because the diet is no longer constantly driving those elevated insulin levels. So if you go back to the old way of eating, the problem is going to return. It's going to come back. So the trick or the key is really to focus on diet and lifestyle and not on medications. All right, so here are some practical take-home points for you. The goal is not just to lower glucose. That's the end result. The goal is to lower insulin. And by lowering insulin, you are going to lower your blood sugar or your blood glucose level. And you do that by